Thank you so much, Lawrence. Good afternoon and welcome to our special webinar, Mind Matters, Destigmatizing Mental Health for a Healthier Tomorrow, in recognition of Mental Health Awareness Month. Before we begin, let me quickly acknowledge this song snippet that we just played was Human by Rag and Bone Man. As part of our series of Heritage and Awareness Month celebrations and our DEI theme for this year, Enlighten, Embrace, Empower, this webinar is an opportunity for us to reflect on the significance of mental health awareness and work towards bringing down barriers that prevent individuals from seeking help and support. We believe that by shedding light on mental health issues and creating a culture of understanding and acceptance, we can empower individuals to embrace their well-being fully. Today, we have the privilege of hosting some incredible guest speakers from Caron Treatment Centers. For nearly 70 years, Caron has been at the forefront of helping thousands of individuals and families struggling with substance use disorders. Their dedication to managing these challenges as treatable diseases has transformed countless lives, and we are honored to have our guests share their expertise with us today. Please note we'll try to reserve a few minutes for audience questions at the end. You can use the Q&A feature on your devices. And now I'd like to formally introduce our guest speakers. Eric Rodriguez currently serves as the Education Resource Director for Caron Treatment Centers. He held previous positions as therapist, behavioral health therapist, and lead therapist. He has advanced education in co-occurring disorders, specifically related to anxiety, and is trained in cognitive processing therapy for trauma. Eric is a licensed social worker in the state of Pennsylvania and has a certification in advanced addiction and drug counseling. He has a bachelor's degree in clinical psychology and a master's degree in clinical social work from Millersville University. Katie Myers is a licensed clinical social worker with over 15 years experience helping people overcome the challenges that keep them stuck. A certified level 2 Reiki and yoga teacher, Katie has a private practice in Atlanta, Georgia, and serves part-time as the wellness coach on behalf of Caron Treatment Centers at Morris Manning, also in Atlanta. Katie just released a new book, Being Seen, My Journey to Self-Love. Dr. Ramona Palmerio Roberts is the Senior Executive Director of Regional Outpatient Services at Caron, overseeing clinical and administrative operations and guiding the development and delivery of exceptional outpatient services. Dr. Roberts has her doctorate in psychology and has many accolades, including attaining her cognitive processing therapy, CPT, provider status, and trained in EMDR, eye movement desensitization, and reprocessing, sensory motor psychotherapy, internal family systems, IFS, trauma-focused expressive arts, and race-based trauma, and how it is carried cognitively in the body. She is currently a level 2 certified clinical trauma professional and is trained in trauma-informed experiential therapies, including sociometry, psychodrama, and adventure-based counseling. Dr. Roberts also authored a book on trauma called Making Sense of What Hasn't Made Sense. We welcome each of you and thank you so much for joining us. To our audience, we encourage you to listen to this session with an open mind and a willingness to embrace the power of mental health advocacy. Eric, you have the floor.
Thank you so much for that introduction. I'm really excited to be here with everyone today. I'm going to start this session with a little psychoeducation foundation, and then I will invite my colleague Katie Myers to talk about her experience and what she wrote in her wonderful book, and then we will also open up then the floor to Dr. Roberts, and I will be asking a few questions of her about specific to trauma and trauma-related disorders, and have her share her wealth of knowledge and experience with everyone today. So really, really excited to be able to share myself, and then also to be able to hear and share with our other two individuals on this session today. So to open us up, Mental Health Awareness Month, Mind Matters, Destigmatizing Mental Health for a Healthier Tomorrow. And when we start to talk about destigmatizing mental health, the first thing that we start to talk about is is, and we should talk about, is stigma and how that might show up. So a stigma is a negative or often unfair social attitude attached to a person, group, or that places shame on them for perceived deficiency or difference to their existence. And that is the definition of a stigma. So a lot of us oftentimes think about stigmas. We think about them in ways of physical attributes, maybe gender, social, economic. It can also be mental health related. It can be addiction related. There's lots of things that accompany perceived stigma. And there's three different types of stigma that's out there. And the first two that I wanted to just bridge with you today is the social and some of the cultural stigmas that exist. And those are oftentimes perpetuated through different avenues, videos, and movies, and some other prejudices that are integrated into some of our cultural societal fabrics that are then perpetuated over time. I think of like I'm a Notre Dame fan, so the Fighting Irish. The Irish are always fighting. When I think about alcoholism, you can start to think about some of the stigmas of different cultural or ethnic backgrounds that are associated with that. So there's lots of different things that are then perpetuated over time, oftentimes through movies and popular culture and stuff, and different avenues. There can then be structural stigma that's associated with that then is perpetuated over systems, and you can think about even workplace being a system, and corporate cultural aspects. And what are we placing emphasis on? It's amazing when I think about Mutual of America and placing specific emphasis on mental health and cultural awareness and those different aspects, because those are just even bringing to light those things, open up the conversations that are associated with it. As my dog starts to bark, I knew that would happen at some point. So types of stigma, also the notion of self-stigma is oftentimes driven by some of those two catalysts of social public stigma and structural stigma that then ultimately creates that internal feeling within the individual, and they start to take on some of those attributes of stigmatized conditions, which can be very, very impactful to the individual. And what does the impact look like? Well, the impact is huge. And when we start to think about the harmful effects of stigma and bias, you start to look at the worsening of some of the symptoms when we start to talk about mental health. Reduced hope can be an effect of stigmatized and biased influxes within the organizations or internally. That reduced hope, another way to say that is depression. Lower self-esteem can look like depression at times. It can ultimately impact and worsen other anxieties and panic and other psychiatric conditions. Social relationships can be impacted. And ultimately, if you're in a system that has a lot of stigmatized language and bias embedded into it, it really impacts the ability for someone to get help or reach out for help, whether that be a supervisor or leader, even internally outside of a stigmatized condition, reaching out to an individual therapist or a counselor to get help. So these systems and these stigma, if there's stigma and there's bias and there's influence for the individual, but also from the systems themselves, those will layer and create really, really impactful situations that someone actually doesn't receive the help that they need or doesn't reach out for the help that they need. So when we think about how do we kind of break those stigmas, how do we kind of start to influence cultural and societal and internal systems, whether that be work or families or any of the systems that we live in, there's a couple of different areas that I would encourage you all that's on this call to support, but also to take it beyond yourself and into the different social aspects of your life and into your families and into your workplace. couple of just different pieces here that I would encourage you to do. One of this is all from the National Alliance on Mental Health, or NAMI, is talk openly. How many times that I've seen as a direct practitioner currently, but working in a hospital, an acute, very severe mental health and substance use, is oftentimes the people that are reached out to ask for, where do I go for support? If I'm suffering from anxiety, what do you do? Do you have any suggestions of people I could call, that I could reach out to, a professional? They're reaching out to someone in their social circle that has identified that they have went through such issues before themselves, or their children have went through such issues themselves. So the ability to just, for you as an individual, or for to spread the message of that there's help out there, or that it's okay to have anxiety, or it's okay to feel down sometimes, or it's okay to struggle, is really the opportunity to help someone else that might be in a critical point at some point in their life, or might just need a hand at some point in their life. So just talk openly, engage with others around you. Educate yourself. We all come from systems, we all come from families, we all come from a different region in the country, a different background, and to be able to open yourself up to different possibilities and opportunities so that we can learn, so we can better assist others around us, and also to be able to grow ourselves. Be very mindful of the language. We never know who's around and who's hearing. So sometimes we can think of like a bias as a very, it's not intended to be harmful, or sometimes we're in a conversation and we say, oh, that person should just suck it up, or, oh, they're just out on whatever. And we can be very dismissive, or we may even state something that might be not intended, but a disparity to what that person is going through. That's going to kind of push someone out of a conversation that might need to be or hear, or they're not going to, the person that hears the individual intentionally delivering some of that language, they're not going to feel comfortable coming to you or expressing certain things, whether that be, again, a friend, a leader, or anyone in kind of that circle. So just be really conscious of the language that we use. Encouraging equality, whether that be physical disabilities and ailments and mental health, or different chronic conditions and cancer. Like, all of these are medical conditions or mental health. All of these are situations we all go through at different points in our life with different people in our life, and to really encourage people to have that experience. Show compassion, honesty about our who we are and where we come from, and really just empower the language and the voice to stop stigmatizing, and live your own life, and live your own story, and own your own experiences, because you never know when those are going to come up, and how that can really truly impact the lives of the people that are around us. Some signs and symptoms to think about when we start to think specifically about mental health. We throw this language around a lot: mental health, mental health disorders, mental illnesses, mental wellness, and they're very different. And just to give you a little bit of an overview, when you start to talk about well-being, mental wellness, you start to think about someone's physical state, sleep, hygiene, how you eat, what you put in your body, mood, how you feel. It's a very holistic, general approach to wellness. When we start to talk about mental health disorders or conditions, or someone having significant impact of mental health, these are really areas that someone is struggling in their life, and is impacting relationships, jobs, functions, really impacting some of the mood, or some of the ways that we feel about ourselves or others around us. And there can be a lot of those different conditions. We have when you put it together, anxiety conditions, substance use disorders, and depression, you have over 100 million individuals in the US currently that are suffering with one of those three conditions. So these are astronomical numbers, and the impact is so much greater to those that are around us. So everyone's feeling it. Everyone has an experience themselves or within their social groups or within their relationships that they can really empathize with someone that might be going through hardship in the moment. Lots of different symptoms that you can look at when it comes to mental health. But what I would say is if you're ever concerned about someone's change in mood or personality, or they're acting different, or they seem irritable or angry, their disheveled physical appearance, they're losing sleep, they just don't, what you have experienced of them in the past is different to what you're experiencing now in any kind of negative way. It's an opportunity to have a conversation and to show care and consideration towards someone that you're concerned about maybe something that's going on, and hopefully that opportunity gives that person an alignment with you to be able to be a support structure in their life, because symptoms of mental health can show up in almost anywhere in any form, and these are just some, but the list is really endless, and I go back to that change in the person as they kind of move forward outside of their normal self. Lots of different stress management techniques that we talk about. And what's really important here is that people manage stress differently. What is stressful to one person, what's stressful to another is just very, very different. When you think about major stressful incidents and losses, potential loss or illness or significant illness that in fact impacts the family, or care for an older loved one that may be entering the home, lots of different major stressful incidents that can come in. But multi-stress or cumulative stress responsive can be as or more impactful when you start to think about incremental stress, and when we just decide to start piling things on. I can take more on, I can take more on, I can take more on. But to what degree is that affecting yourself or your hobbies or your recreation or your social engagements or your happiness level? And what I would pose to you is, when you get stressed, what happens for you? Because everyone handles and manages stress differently. And that gives us an opportunity to go, if I, as an individual, if I see myself doing this or managing this way or feeling this way or holding stress in my neck or in my jaw, I know that that's a telltale sign that I have to take a step back and start to look at what is going on and how am I managing today. Lots of different stress management techniques out there. I'm going to highlight two in mindfulness-based stress reduction and progressive muscle relaxation. Both are very good life skills. Progressive muscle relaxation is great for sleep and any problems with really sleep, insomnia, some other different reduced chronic pain issues. Mindfulness-based stress reduction greatly reduces stress and really creates more balance and kind of equilibrium in our lives. So both of those techniques are great and have long-term positive impacts on someone. If you want to know more about them, there's a lot of information out there, and I'd encourage you to seek out some different literature, some YouTube videos or whatnot. To finish us up today, I'm just going to touch very briefly on coping and adaptive coping. Adaptive coping is really a learned process of being able to tackle some problems and situations and be able to create balance and realistic perceptions of those issues or those problems that come up. Again, it's learned. So when you start to think about how do I take on, how do I manage, how do I develop MBSR, progressive muscle relaxation, there's skills. You learn them, you can then adapt them into your coping and how you manage or confront issues to finally adaptive coping. Most people use multi-mix, like we use healthy or adaptive coping, we use maladaptive or negative coping. I think of someone that manages social situations with drinking alcohol, maybe not necessarily impacting anything else in their life, but it's not necessarily the healthiest way way to manage social anxiety. Again, just a very minor example. Oftentimes we use a mix of healthy and unhealthy coping techniques. So the goal is to move those unhealthy coping techniques into healthier coping techniques and reducing the unhealthy coping techniques. Another great question to pose to yourself as we continue forward is, what kind of positive coping strategies have I used in the past, and how can I implement them and continue them forward? Here is a list of some wonderful ways to cope: exercise, meditation, radical acceptance, which is a mindfulness-based stress reduction terminology there, humor, meditations, reframing, lots of different examples, and also activities when you start to talk about adaptive coping examples. So right now, I would like to stop sharing my screen, and I would like to introduce you all to Katie Myers. So Katie Myers, as she was introduced, is a licensed clinical private therapist, a wellness professional, and an amazing author of Being Seen: My Journey to Self-Love. And I was really, really excited to invite her on today and to really just tell us a little bit about her story and really what motivated you to write this book.
Well, thank you, Eric, and thank you to everyone who's joining us. I'm going to start with a quote. I am a big fan of Marianne Williamson. She is an author, and I think about mental health awareness and self-care, and I think about those who are open and honest and vulnerable are like these beacons of light, these beacons of hope. And she has a quote in one of her poems where she says, "As we let our own light shine, we unconsciously give other people permission to do the same. And as we are liberated from our own fear, our presence automatically liberates others." And that's been my motivation in becoming a social worker, a therapist. I am extremely open about my own personal struggles, and my history has been in working with professionals, working with people who are highly successful, highly driven, really powerful, and incredibly bright people who were brought to their knees by their addiction or mental health diagnoses, and really working with like the stigma and the shame that comes along with that. And then myself being somebody who I consider myself to have in so many ways a lot of success. And I myself have been brought to my knees due to depression, anxiety, substance use. And so I share my story in hopes that it will encourage others to share their story. Because when we talk about, and this is kind of the beauty of like therapy and group work, when we talk about our struggle, we begin to realize that we're not alone. And that reduces the shame and the internal shame. And hopefully that trickles outward and becomes reduction of stigma within our world and our society. And so, yeah, I'm a wife, I'm a mom, I am a therapist, I'm an author, I have depression, I have anxiety. I actually went to treatment for depression and anxiety about 2.5 years ago. And I write about it in my book, Being Seen. This just came out last month, and I worked on this book for over 10 years, just kind of talking. It started as like a journal to just help me process some things that I was going through and some occurrences and events. And it turned into this book. And my hope again is that if anybody picks this up, if anybody reads this, if there's just one of you that finds a glimmer of hope through my story, my job has been done. But I wanted to share a little excerpt where I was actually the executive director at the Karen Atlanta outpatient location, so do outpatient substance use treatment. And I found myself kind of, as Eric described, like not coping, taking on more and more responsibility, not allowing the very healthy and appropriate words of like, no, I'm sorry, I can't do that. Setting boundaries, practicing that self-care for myself, I really let those pieces go. And being a mental health professional and being on one side of the dynamic, being the helper, I found that when I went to get help, um, I experienced a lot of internal feelings of shame and doubt and hopelessness. And that was part of my depression and anxiety, but also just part of our society. And so allow me to read just a little snippet. And this is titled, Who Helps the Helpers? I've walked professionals through the incredibly difficult process of asking for and then being willing to receive help. Those who are successful in other parts of their lives come to an understandably difficult crossroads of how can I achieve so much in these other areas, but insert addiction, mental health diagnosis brings me to my knees and I can't fix it. It's humbling, it's scary, and it's 100% necessary. Asking for help, that is. Our shame tells us that we should be able to handle it. We should be able to get it together. Been in the industry for almost 20 years and have been a fierce advocate for those who are fearful to access help for whatever reason. And there I sat, feeling shame and having difficulty finding the right words to let someone know that it was me who needed help this time. And even as I read those words, I am transported back to that time. And I remember sitting on my phone, my cell phone, on the edge of my bed and being overwhelmed. And I needed a me to walk me through. I needed someone to help me through what I was experiencing, and I didn't have access to it because I wasn't willing to ask for that type of help until things got really bad. And so if there are any people on this webinar or watching, listening to this later who are thinking, man, that kind of sounds familiar. There's a real struggle, and I don't know who to ask for help. I don't know how to ask for help. There are lots of resources, and Eric listed a bunch of ways to connect with Karen through different social media outlets. There will hopefully be some links and some ways to access communicating with me to reach out for resources. It doesn't matter where you are. There are people out there who are equipped to help you, and you're not alone. You are not alone. We lose far too many people to suicide because there's just this feeling of hopelessness, and addiction and mental illness does not discriminate. It doesn't care male or female. It doesn't care if you have a family. It doesn't care how many zeros are in your checking account. It doesn't care. And so we're all susceptible to it. And yeah, I hope that part of my story allows or gives freedom to whomever who might need it, the willingness and the hope to reach out for help. And, my private practice today, I work with individuals and couples. And as Eric mentioned, I get the opportunity of working with a law firm here in Atlanta as their wellness consultant. And I share sometimes about my story when it's appropriate. But it's incredible to me, the amazing people who come through the door of my office or who I get to interact with at the law firm. There's just no shortage of incredible people out there who are suffering in silence. And yeah, I'm a big self-care advocate. I've done presentations and CEU events for mental health professionals to take extra care of themselves through self-care measures and saying no and setting boundaries and having healthy coping mechanisms. So it's kind of my jam. I love talking about it. I could talk about it for hours. So if anybody is looking for a resource, happy to help in whatever way that I can. Again, my book is Being Seen. It is my story. I go through my depression, my anxiety, some suicidal ideation, an eating disorder, postpartum depression, infertility, marital issues. So if you're experiencing something out there, you might find a nugget of help in my book, because I have gone through the gamut as a client, not just as a mental health professional guiding clients through the struggle. So yeah, that's my story. I'm sticking to it. I'm proud of my scars. I'm proud of the purpose that I have found in my pain. I'm proud to be a healthcare provider, and I'm proud to be a person who's recovering from all different types of mental health diagnoses, mental illness. I love the breakdown, Eric, that you gave of like mental health, mental illness, and like we use those words interchangeably a lot, but they're different. And I'm just honored that I get to be a part of things like this and share my story. So thank you.
Thank you, Katie. I think of Dr. Brene Brown, and she's written so much, and you say like being seen, and like the most important and sometimes the most impactful thing to say to someone that might be struggling with anything. I mean, anything across the board, would be me too. I also struggle, and we struggle. But if we can struggle together, there's a lot of power in that. And then we see something that might be alone as like a impossible or deficit or something wrong, and you just see it in such a powerful and strength-based perspective. I go back to my to wear my clinical hat, strength-based kind of work that we do, and so her name, Dr. Brene Brown, if anyone wants, it's a great, she's written so much. And I also wanted to just ask you one question before we shift gears. And thank you for being on today, and thank you for sharing your emotion, because you could definitely feel the emotion when you speak. What's it like today?
Crazily different than what it was 2.5 years ago. So a little bit of I went to treatment, outpatient treatment for anxiety and depression. It was during the tail end of COVID, but it was online. I got hooked up and connected with an incredible therapist. I take my meds. I do what I'm told when my doctor tells me what to do. I do it. And I started doing this like life coaching program where I just started giving myself permission to live my life, to live according to what I was created to do and my passions and what I feel my purpose is, and stopped a lot of the chatter. There's a lot of chatter out there about what you should do and what you shouldn't do and what you can do and what you can't do. And I just really released a lot of those self-limiting beliefs. And I can't even, this is what I can point to is the smile on my face reflects the smile in my heart. And I found, y'all, before I couldn't smile for anything. Couldn't smile for anything. There was no reason. There was no internal anything to smile. There's nothing external to smile about. But today, I'm so grateful that I had helpers guide me along the way, and life is absolutely 100% different than what it was before. And thank God for that.
Thank you so much, Katie. You can definitely hear it. You can hear it in your voice and how excited you are about life, and how much of that is just sometimes perpetuated noise and chatter and history and families and what we should be and what we should do and how we should operate, and coming back to like yourself and like what you are passionate about and what drives you and why you wake up every morning and put your shoes on and put your best foot forward. So like that's Thank you, thank you, thank you so much for joining me today. And I'm so blessed to be able to work with you,
I know.
which is just fantastic.
Totally. Thank you so much, Eric. And thanks, everybody.
Thank you. And we're going to say goodbye to Katie and for the temporarily, and then we'll invite some questions at the end. But who I'd like to introduce now is Dr. Ramona Roberts, who was introduced. She's our Senior Executive of Outpatient Care at Caron. She's also an amazing, experienced trauma professional. And when I thought about what could we highlight when we start to talk about mental health, I thought someone needs to talk about trauma. Because it's so prevalent and so out there. And it is mental health and addictions and physical health and cultural and gender like there's a lot of things that we don't talk about that we need to talk about, that it's at least talked about a little bit. Trauma is one of those things I don't think we even talk about in conjunction with the other things that are like sometimes taboo or stigmatized conditions that are out there. So this was like one that I pleaded with her, not really, I just asked her and she said yes, because that's who she is, to be able to come on and talk with us. She's also an amazing author of Making Sense of What Hasn't Made Sense, which is such a telling title of trauma and traumatic experiences in life. And I just wanted to I'm gonna ask her a couple of questions, but the first question is for those of you that aren't familiar with trauma, because I think that there are certainly people that are, and there's certain people that certainly don't know much about trauma or traumatic experiences in life. How would you explain trauma and how it affects people, how it affects individuals?
One intro. Thank you for that, Eric.
I set the bar low, right?
Yeah, the pressure is on to deliver to y'all. I hope I can give you some nuggets you can leave with. And I think too, to answer that question, I'm going to answer that question. I'm going to also say that you led us into this with the whole conversation around stigma, right? And so I think how fitting to talk about trauma, because there is so much stigma around that. I'll give you an example. I gave someone a diagnosis of PTSD once, and they said the words back to me, "Take it back." That was the response. Take it back. I don't want that diagnosis assigned to me. And of course, we had a lot of conversation around it. And the stigma is, I'm weak if I have trauma. If I'm assigned a diagnosis, or I'm super weak. I think culturally, there's a lot that goes into that. There's a lot of societal beliefs and sayings and kind of those phrases and, pick yourself up by your bootstraps and, so I think understanding what trauma is, and then all that goes into that, because you mentioned it's so all encompassing, but understanding first what trauma is, it's got a big kind of depends answer, right? Because so many things can fill into that blank of what is trauma. It is so subjective. It's really intensely stressful, sometimes inescapably stressful events that end up overwhelming a person's ability to cope. Someone I follow a lot, Dr. Gabor Mate, talks about it as being an inner injury, what happens inside of you as a result of what happens to you. And I think some of these events that we could use as examples that could lead to this experience and this response of trauma, we can look at anything from abuse, neglect, and when I say abuse, sexual abuse, physical abuse, domestic violence. We could look at car accidents. We've got abandonment, bullying. Some people think of trauma as these one big events, and others are more insidious. So bullying, chronic, racism, discrimination, oppression, a much more chronic nature to it. In immigration, incarceration, let's say reentry after incarceration, all of these things can can fall into that trauma realm. There's so many, it's such an exhaustive list. I would be on here the whole time naming more items. I think a long time ago, people knew trauma as those military vets coming back from war. And sure, that is still what we treat as well. A lot of VAs are doing some fantastic trauma healing in that. But the understanding has broadened, and the lens has broadened. It affects us in the way that we live, the way that we show up in relationships, the way that we love, the beliefs that we have about ourselves, other people, the world. It affects how we make sense of things. It affects our brain and our nervous systems. It is a mind-body impact. But as you know, Katie was talking about some hope, I always make sure to say trauma impacts the brain, and healing does too. So there is hope, right? It's not like, oh, I'm permanently damaged from this. But we develop a lot of responses out of a survival. Our brain and our body really tries to work for our own good. And what some people would refer to as maladaptive symptoms or unhealthy or bad, that's a term I want to like kind of X out, bad. But you know, a lot of people in the field and people who don't have any education in trauma can use this type of language. And really, another great expert in this area, Dr. Frank Anderson, always talks about one of his 4 T's is to thank your responses, because it is really out of a survival mechanism. So the reason why you might show up in relationships and push people away is to protect you. The reason why you might show up in relationships and cling to other people, why you might throw things when you're angry, all of these things, now they have some consequences to them, right? But they're showing up because they want to protect you. So I think that's often misunderstood, or why are you behaving this way, you know?
Yeah, I think of like that post-traumatic stress disorder diagnosed, that PTSD, very military. I mean, I think that's naturally kind of where your brain goes to, is like someone went to war and came back. But as you expressed, trauma is so broad and can kind of show up in so many different areas and affect so many different things in our lives. And that notion of like getting help can be impacted due to the traumas, because of safety and making things real, or maybe even feeling, I think you used the word, or so, like feeling damaged, feeling that you know, you are unable to get well. And I've seen that so much in traumas that kind of come through. So I think we touched on a little bit about misconceptions of traumas, but of trauma or treatment. But what are maybe some common misconceptions of trauma or trauma treatment, or what like?
I know I touched on some, but I do have more. A long list in my head, so I can give you more. So I think one, and this actually struck me at a conference once. I felt disappointed for the panel because the panelists were trauma survivors, and I felt disappointed for some in the audience because the message that was really getting out was, this is going to affect me for the rest of my life. And actually, a lot of us in the field will say, like, that's a misconception in terms of this is a death sentence. You're going to suffer from this PTSD the rest of your life. And for some people, it might be a 30-year journey of healing. For some, it might be a year. It all depends on what that person's experiences are. And there is a lot of healing to be done that can be done, right? Just as I said, you know, trauma affects the brain, so does healing. So I think we need to make sure we don't look at this as kind of a life sentence, death sentence, because then we get into more of those examples where a patient says, no, don't give me that diagnosis because I know what that means. And it's like, wait, we have a lot of healing we can do. There's something called post-traumatic growth that is being talked about a lot more where one experiences these kind of increases in their personal strengths, improved relationships, spirituality, appreciation for life, a number of different areas that kind of come as a result of going through this experience. And I think that's also important for people to have a focus on in treatment and being able to have this post-traumatic growth. I think resilience is a big thing that people have moving through their traumas. And even for those, so in terms of prevalence, about a third of people who experience trauma go on to get the diagnosis of PTSD or a related diagnosis, because there are other trauma diagnoses there as well. But about a third of people don't experience any symptoms, and a third of people go on to have a very short-lived diagnosis. We call that acute stress disorder, something very short-lived. And I always like to tell people that the group that goes on to have no symptoms, they're not the resilient group. I actually think all three of those groups are quite resilient. Now, the group that doesn't go on to have any symptoms, they might have a number of other protective factors in their environment and internally that help them not develop it. But I think those who do develop symptoms have a lot of resilience. Again, back to that survival kind of concept. I think that another misconception is that you need to talk about all the details of your trauma to heal from it. There's a variety of modalities and approaches to trauma. A lot of them don't involve you talking about all the details over and over, kind of retelling, reliving. Again, Dr. Frank Anderson will talk about being with it and not being in it. I think another misconception is that you need gender-specific treatments. People oftentimes will go looking for gender-specific treatments, and if there isn't one, they think, well, I can't go there for treatment because there isn't a group just for women or just for men. That is a wonderful thing for some issues to work through that can be gender-specific. And there is such a benefit to having co-ed groups. We'll have some, let's say a woman might say, I don't want to be in groups with men because I don't feel safe, I can't trust men. Well, there is a lot of opportunity for these, what we call corrective emotional experiences, to actually have opportunities and learn to build kind of that trust and safety radar to a better place where you can have opportunity to learn who you can trust in the world, because living the whole rest of your life not being able to trust a whole group of people doesn't serve you very well. I can think of a client that works with a male therapist we have that at the beginning, female, had the same kind of thought of, I need to work with a female therapist. Now we're, a year in, and at one point, the client actually said, reflecting back on the beginning, you know what, like, this actually was great because I do have a model experience of a trusting relationship with a man. So, just to say that they don't all have to be gender specific, even though some programs that have gender specific do have great benefits around that too. But just to keep that in mind. I think another one is so language was talked about. Big T versus little t is a term that we're not all in agreement on in the field. I think it's well intended to help people understand what trauma is. Some of you in the audience or hearing this later might have heard the term big T used for, these kind of single events like the car accident, the assault, and little t might be used for the insidious racism, bullying, neglect and toxic relationships in the home, growing up with substance use in your home. But I think even Robin Brickell, a colleague of mine, uses the term hidden versus obvious. I prefer that. I think a lot of us in the field struggle with big T, little t, because it can imply a minimization of someone who has little t, where their experiences have big impacts still, right? So I think language is important in our trauma arena as well. And I think I think I could go on. So
yeah,
next question.
no, it's fascinating. I learn stuff every time we talk. And we did trainings for years and years together. You talked a lot about the treatment aspects, and I think it's always really, really important to highlight the treatment effectiveness that is out there, because I think that has oftentimes been, certainly in the field, but I think it reverberates outside of it, just in structural of like, this isn't treatable. Like, you're kind of just going to live with your symptoms. Like, there's no resolve, there's no reduction, there's no help. And you talked about all the many options out there and the treatments out there. And I wanted to ask you one more question before we jump to Q&A. And one of them just is like, my experience has been trauma is oftentimes the last diagnosed condition. Oftentimes other stuff is diagnosed well before the trauma, for the reasons that you talked about, is people tend to not want to talk about it because it's safety, because it's, if I open it up, I'll never be able to close, what comes out of me, even opening up the door, that I might have been assaulted or I was bullied, or, all those different things. So how does this affect mental health? How does trauma affect all the other mental health? I'm going to give you 2 minutes to be able to tell us, which I'm sure there's definitely not enough time, but I definitely want to spend at least 5 minutes on Q&A.
You've got to be really good at your diagnostic assessment and clarity and differential diagnoses. What that means for lay people, teasing it apart, because there are a lot of misdiagnoses. There's behavior that can look like ADHD that is trauma. There's behavior that can look like bipolar disorder that could be attributed to trauma. Anxiety, depression, personality diagnoses. There are so many things, and you're right. It's like, all right, I'm going to treat the substance use, and then I'm going to treat this over here, and I'm going to treat that, eating disorders, and then, my goodness, after all this work, I learned I should be treating trauma here. That's not to say that people don't have authentic ADHD, bipolar, and personality disorders, or that they can have co-occurring, because they can have both at the same time. I think we really have to be on our game with identifying, assessing, teasing through, making sure we ask about trauma in a way that's not going to dysregulate them and actually re-traumatize them by asking the question. We've got to be careful with that, but making sure that we give proper assessment and look-see into all these things, especially substance use. We're looking at 70%, studies will show 70% to more, some will show between 70 and 90% of our substance use disorder clients have histories of trauma. We need to focus on that. If we just look at the adult population in the US, we're looking at 70% of people have experienced trauma. When we look at kids, half of children have that in their life experience already as kids. When we look at by their 16th birthday, 2/3 of them by their 16th birthday. So we're all walking around with stuff. And I think with Katie talking about, kind of normalization of it, if we just can remember in our minds, that we're all walking around with stuff and have a little more understanding. I think one of the best pieces of advice, if I could give, is whether you identify with having trauma or not, read, watch podcasts, listen to podcasts, watch YouTube videos, pick up my book, Making Sense of What Hasn't Made Sense, pick up Katie Meyer's book, get educated for yourself and a loved one, because it will help you understand a lot better what's happening in front of you, and that's going to change how you respond, and it has this whole reciprocal impact, how we can be a whole lot kinder to each other when we understand what might be going on in someone's world. Was that 2 minutes?
That was perfect. Thank you so much. That really brought us back to, like, how do we change, and like not just change ourselves, but change those that are around us in society, and we want to live in a better place. And if that's true, it starts with us. So that's a great place to kind of end for today and open up for questions and answers. And I just want to say thank you, Dr. Robertson, thank you, Mutual of America, and thank you, Katie, for hosting and being here. And thank you just so much. And again, if there's any questions if there's any questions, please chat, or the other ways that Lawrence identified to get us questions. Or I will just sit here looking at two very wonderful, powerful women. And that's great. And that happens to me often, which is a blessing in my life. We can also just do that.
I am happy to join you again. I was going to have Anita handle some questions. I didn't think we had any, but Anita, if you don't mind, I do see a couple coming in now. So I will turn that over to who this is for. I know we have two esteemed authors on our panel today. So the question from one person is, where is each book available?
For mine, Making Sense of What Hasn't Made Sense, you can get it on Amazon, Barnes & Noble, anywhere you can buy books online. If you want an autographed copy, you can email me. I do have a Venmo, and you can do that, but you can email me, and I'll send you that link. My email is rroberts@caron.org, RROBERTS, did I spell my name right? Yes, at CARON.org.
Wonderful. And the second question that I see is similarly for the book availability. So Katie, I'll turn to you as well.
Yeah, I'm available on Amazon.
Okay. And we do, as I mentioned, share this webinar after with all of our attendees so they can watch again. And for those who couldn't make it, there'll be a recording, and usually we'll also share some information. So I imagine we'd be able to share your contact or the book availability when we send the communication out as well. I don't see any other questions coming out, and I'll be respectful of time. If you don't mind, I just want to again just thank you all for joining us. This is the first thing that came to mind as I listened to each of you. One word, powerful. And that speaks to your areas of expertise and all the great information you shared, but also your lived experiences, the personal storytelling. I know for me it resonates. I've heard from other employees, colleagues, if you will, in prior sessions that, that goes a long way as well. Such an important topic. We're here at work. But there's also life, right? So the balance of that can often be a struggle. Takeaways that I think I won't be alone in saying this are, it's okay to not be okay. Learning how to be mindful of how we treat ourselves, but also others. So those, healthy coping strategies, the language and everything that we've heard in today's session, talks of trauma, be it big T, little t, however you phrase it, trauma is trauma. Lesson learned, I got that, and I think others will too. Okay to seek help from professionals like yourselves, and more importantly, no shame. And that's what this is all about, the mental health advocacy that we're talking about, and taking away the stigma. So can't thank you enough on behalf of my colleagues, our team, our entire company, saying thank you once more. Also want to take time to thank everyone who helped plan this wonderful event. We have some information on our HR dashboard, and we'll see if we can add to that in terms of resources. I think that's important in terms of everything that we alluded to today as well. And to our audience, those who were able to attend live, but those who join us later, again, we'll share the recording. But to that, I just want to, just say thanks once more. And we certainly hope that everyone has a wonderful rest of their day. Thank you so much for joining.
And Tish, the song, how apropos. We're only human after all. It was a perfect pick from Rag and Bone.
I would agree.
That was perfect.
I would agree.
Thanks, everyone.
Thanks, everybody.
Thank you.
Thanks, everyone.
Take care. Okay, bye-bye.